Dr. Ron Dittemore began his long career with the Department of Mental Health in 1966 at the St. Joseph's State Hospital as a special education director. He was then Director of Youth Services and Director and CEO of Woodson Children's Psychiatric Hospital. During his time as a leader in mental health, he made dramatic changes to the culture of those facilities.
Dr. Dittemore really changed the culture of the hospital with his attitude toward people and friendliness, and then he brought forth the Stephen Covey learnings, which were First Things First and Principle-Centered Leadership and all of those programs, and eventually taught those basic things to the entire staff. And it made a great deal of difference, I believe, in the culture.
You know, he was one of those that he wanted to earn your respect. He never demanded it because of his position. And I thought that was something that was a good trait that he held. And he also, you know, he wanted to lead by example.
As superintendent and CEO, Ron was instrumental in overseeing the construction of the new building, Northwest Missouri Psychiatric Rehabilitation Center, which replaced the state hospital. Providing excellent treatment and caring for each and every patient was Ron's top priority. He also took great pride in preparing patients for life after they left the hospital.
He thought it was important that our patients not only get treatment, but they develop some self-worth. And so he was big into the work therapy program and really promoted it, expanded it. And so it was a program where they learned various skills, actually got paid a small amount of money that they could learn how to handle their money and learn some job skills. So whenever they were released, they would have some areas that they could go out into the community and either find a job or put that on their resume and use that after they were gone from the hospital.
After retiring from Northwest and then working as a consultant for Heartland Health Regional Medical Center for several years, Ron returned to public service in 2005 when he was appointed by the governor to serve on the Mental Health Commission. His understanding of operational issues was invaluable to the commission, so much so that in 2006 he was asked to serve as the Department of Mental Health's interim director.
I don't believe that there is anybody in departmental health going from the teacher, director of education, as youth center, becoming director of department. You know, this was really scale that he had to go, and it is due to his commitment, dedication to mentally ill, to the program, first to youth, and then to adult, and to I think it was a big contribution to the state of Missouri.
Ron's leadership at the department brought stability to the system and ensured that internal and external review policies affecting care, treatment, and safety of consumers were done with transparency.
But his leadership was one of transparency. He would let the staff know, you know, here's the issue, here's where we're at financially, ask for their input in decisions of what they would recommend of how we could make any cuts, but it was always prefaced with, you know, least impact on patient care. So he was very open about that, and even though he had to ultimately make the hard decisions, he wanted everybody's input into it.
Ron was a master of negotiating and an excellent communicator and collaborator.
His style is being a great communicator, and people really relate to him, and he likes to talk to people, so much so that that was probably my hardest job, was to keep him on schedule.
He was highly conscientious, competent as professional, and I would say he was also what is a quality to survive within departmental health with many controversy, to be good diplomat. My wife would say that he was very good diplomat, you know. It's, in particular, when you are director of facility, you have to go before this committee and arguing for money, And what is also, you have to prove your case. So he was very competent, dedicated, very committed to improvement of mental health, what I told you.
Under Ron's leadership, the department gave new priority to listening to the voices of consumers, their families, and all Missouri citizens. His character and dedication to public service, his community, and his family were deep and lasting.
He always made you feel important, and I believe he did this with everyone he spoke with, and gave respect and got it in return. He always got more than you thought you could do just because of his whole attitude. And that was a very special thing about him.
He met this one old boy and he said, I guess he grew up in the rodeo profession. And so, and he was elderly at this time, and Ron met him and he said, the only thing I regret is not being able to go to a rodeo. And Ron found out within the next 2 or 3 months that there was a rodeo coming to town. Of course, you couldn't do that these days, but
Yeah.
he arranged for him to go to that rodeo.
Oh my God.
Yeah, so that kind of tells you the type of person he was.
Dr. Ron Dittemore died in 2018 at the age of 79, but his legacy in mental health is lasting.